As John Quincy Adams once said, if your actions inspire others to drink more, learn more, do more, and become more, you're a leader. In dentistry, especially in remote communities, leadership isn't just about clinical excellence. It is about showing up with heart, listening deeply, and building trust across miles and moments. Whether you are fresh out of school or decades into practice, how you lead shapes how you serve. Today, we're exploring what it means to lead with intention, compassion, and heart, especially in regions where access to care often depends on air travel and long distance coordination.
Welcome to the Pillars Pod, where we explore the values that elevate dental professionals: excellence, ethics, professionalism, and leadership. Whether you're an ACD member, a dental student just starting out, or a seasoned practitioner committed to growth, this podcast is your space to reflect, to recharge, and to reimagine your impact. I'm Dr. Sonia Sluida, joined by my co-host, Dr. Syra Paradis. And today we're thrilled to be welcoming Dr. Louann Visconti for an episode that's close to the heart: Northern Exposure, Dentistry in the Heart of Northern Ontario. Let's dive in.
Dr. Louann Visconti brings not only decades of experience, but a deep commitment to her community and profession. She's a leader, a mentor, and someone who has made Northern Ontario her home in every sense of the word. Dr. Visconti is a passionate orthodontist and a dedicated leader who has been serving the Timmins community for almost 30 years. She graduated from the University of Toronto and the University of Manitoba, and she has made a real impact by improving dental care in northern and remote areas, always with compassion and creativity. She's currently the chair of the Ontario section of the American College of Dentists, and she has taken on key roles with both the Ontario and Canadian dental associations. Outside the clinic, Dr. Visconti gives back through local volunteering, and she even plays violin in the Timmins Symphony Orchestra. Dr. Visconti leads with kindness, heart, and a deep commitment to her community. We're very happy to have you with us, Louann, and what a biography. It's amazing.
Thank you. Welcome to the Pillars Pod, Louann. Let's get started. After finishing your specialty training, you could have practiced anywhere. What enticed you to set up in Timmins?
Well, that's a great question, Sonia. Following my graduation from the Faculty of Dentistry in, dare I say, 1988, I had the wonderful opportunity to do an internship at Sunnybrook Medical Center. One of the requirements of the internship was to go to a remote community to provide much-needed dental services. While in Big Trout Lake, I met a commercial pilot from Timmins who was flying individuals around who were staying at the nursing station where I was, and they were checking things out like fire safety codes in schools. That commercial pilot is now my husband of 36 years. And while not originally thinking of Timmins as the place to live and practice after my graduation as an orthodontist in 1992, the possibility was brought up to me by a local dentist in Timmins in the summer before I completed my orthodontic program. At the time, you have to understand that Timmins did not have a resident orthodontist. However, they did have one that traveled to Timmins every 6 weeks, working out of a general dental office, and he split his time between Timmins, Sudbury, which was his home office, Sault Ste. Marie, and North Bay. This orthodontist was actually in the process of retiring out of the profession when I made the decision to make Timmins my home.
That story is incredible, Louann. Love, timing, and a community need. It's a reminder that sometimes the most meaningful paths aren't planned, they are just discovered.
That's right.
Yeah, and also once you've arrived, what did the dental landscape look like? Was there any early surprises or challenges?
Well, at the time that I moved to Timmins in 1992, not only was I the only orthodontist out of nearly 400 registered in Ontario, but the only dental specialist in Timmins and the surrounding area. Now, I'm going to give you an idea of just how large an area I provide services to. It's probably approximately 450 square miles. So I provide services from Timmins north to include remote communities up the James Bay coast, to the west as far as Marathon, which is near Thunder Bay, to the east to Rouyn-Noranda, Quebec, and to the south, Sudbury and North Bay. Now, being the only orthodontist in a city with no other specialists, I opened my own practice and I have been working as a solo practitioner from that time to the present. And I can tell you, as a new graduate with no one to guide you, this was very challenging because as a solo practitioner, you are everything from CEO of the practice to HR manager, hiring and firing people, manager to clinician, managing both staff and patients, all while gaining clinical competence and experience. So it really is quite daunting, but so well worth it.
Being the only specialist and juggling every role in your practice must have been a huge learning curve. How did working in such a remote area with all the travel and distance involved shape the way you care for your patients?
Well, being the only resident orthodontist for at least 20 years, there were certainly many opportunities, but also many challenges that those in larger urban centers with access to other specialty services just do not encounter. Half of my patient population resides outside of Timmins, some as much as a 5-hour train ride away. So it's sometimes difficult to run the office on a tight time schedule as there may be delays in travel. And if there is something that is broken, it will have to be fixed at the same appointment if possible, rather than rescheduling them to come back. Also, living in an urban center, if the need arises to refer your patient to another specialist, for example, a periodontist for gingival grafting or a cuspid exposure, or for an orthognathic surgical procedure, it can be done with relative ease. They can be referred to someone who practices close to where they live and work. However, in Northern Ontario, patients and parents must take a full day and sometimes longer to travel to appointments that may only be 15 to 20 minutes in length. This is not to mention the costs that they have to incur of travel, such as gas, sometimes airplane or bus tickets, accommodations, for which they are not reimbursed, as travel grants are only given if the individual is going to have a procedure carried out that is covered by OHIP. One positive aspect I can say of the COVID-19 pandemic was the improved use of technology for virtual consults, which can work well in some instances, but not necessarily in others where an in-person appointment really is imperative to make a diagnosis. For those individuals who undergo an orthognathic surgical procedure in conjunction with orthodontic treatment, they must travel to see the surgeon. In an urban center, their postoperative care would be carried out by the oral and maxillofacial surgeon. However, as these patients are seen weekly during the immediate postoperative period, I am the one that carries out all the postoperative care. Another difference in large urban centers, a patient can have their braces removed in the morning and have laboratory made retainers inserted in the afternoon. In Northern Ontario, impressions are taken with the appliances still in place and then removed completely when the retainers come back from the lab in Southern Ontario. Now, the lab does remove the braces from the model prior to fabricating the retainers. The patient would have their deep end, where we remove all braces, 10 days after the impression appointment. What we have started doing, and what we've been doing for the last little while, is we remove the braces and provide the patient with temporary plastic mouthguard like clear retainers in the same appointment. These temporary retainers are fabricated in our office. The post-treatment models taken with the braces removed are then sent to the lab in Southern Ontario to make the retainers, which are fitted and adjusted 10 days later. Another very significant difference is in creating comprehensive, multidisciplinary treatment plans. That continues to be challenging owing to the lack of specialists in the North. This gap in the accessibility of services also affects the ability of local dentists within the Timmins community to provide the best treatment for their patients. In many cases, it is dependent on the patient's ability to seek these much needed services out of town. Now, there are a few practices in Timmins that have grown very quickly by incorporating the practices of retiring dentists in the area. And within the past decade, and with the need of patients in mind, these larger practices have now started bringing in various specialists to work out of their practices. These specialists provide locum services in the areas of oral surgery, periodontics, and endodontics. And I can tell you, as an orthodontist in Timmins, this has certainly enriched the dental community and facilitates the multidisciplinary approach to treating our patient population, providing accessible services to patients and removing the additional burden that extensive travel places on them.
It is really great to hear that at least more recently, technology and increased manpower has improved accessibility to comprehensive and multidisciplinary dentistry for patients living in Northern Ontario. But it's clear that it is early days and that accessibility and convenience continue to be of concern. Hopefully, this aspect will continue to improve. But let's shift to the current patient experience. What are the most common oral health care issues that you see in Northern Ontario? And are there cultural or demographic factors that influence care?
There certainly are. As there is no fluoride in the water in Timmins and the surrounding communities, and certainly not in these remote communities up the James Bay coast, decay is very common and is from anything from white spot lesions to more extensive caries, and which often requires extracting the teeth versus endodontic therapy. And it's not uncommon for young individuals that I see to be missing molars or bicuspids from a young age, and we see the effects of this cosmetically and functionally. A few years ago, sadly to say, there were a rash of suicides, particularly in one remote community. But this unfortunately occurs more often than we like to believe, especially in these communities with young teenagers. There are many barriers to accessing dental care for individuals within these remote communities. For example, they do not have potable water in many communities. Eating healthy is difficult owing to availability of fresh fruits and vegetables, as well as the prohibitive costs for these items and other items such as milk. Housing is often a crisis in these communities as well. These people are facing so many seemingly insurmountable challenges, and yet we focus on asking them why they have not been brushing or flossing when they are battling all these issues, and parents are just trying to keep their teens safe and alive.
Some of those stories are very touching, and it's quite humbling to hear how broader social issues intersect with oral health. Luan, are there local resources or support systems for patients who struggle to access or afford care?
There are, as in the urban centers, there are provincial dental programs such as ODSP, Ontario Works, and Healthy Smiles Ontario. And now we have the Canadian Dental Care Program, which is available for all those households whose annual income is less than $90,000 per year and who do not have access to dental insurance. The good news is that there is a coordination of benefits with these provincial dental programs, so patients actually have better coverage for some dental services than they had in the past. For our Indigenous patients, there is coverage for dental work under the Non-Insured Health Benefits Program. This program also covers some individuals for their orthodontic work, and if denied for coverage based on the program's criteria of severity of the malocclusion, Jordan's principle is an alternative pathway for funding for treatment. The issue is that in very remote communities in the far north, there is no resident dentist, and sometimes visits can be very sporadic. Individuals are often seen and triaged by the nurses at the nursing stations within these communities, with those that are in catastrophic condition being flown out to the nearest dental clinic in Moose Factory, and sometimes even beyond that to Kingston or Ottawa.
My goodness, the status quo as you described it, Louann, is truly eye-opening and disturbing to say the
Mhm.
least. And as a professional living and working in a small community, it must be trying at times to separate the patient's immediate concerns from these larger concerns. But additionally, by virtue of living and working in a small community, you surely must have to make a purposeful effort not to blur the lines between personal and professional life. Is this the case, and how do you navigate this issue?
That's a great question. In a small community, it can be difficult to separate the private or personal from the professional life. It is not uncommon to be in a social setting and being asked questions about dental issues, such as, should I have my wisdom teeth out? Or should I get a bridge versus an implant to replace a tooth that I just got removed? But the biggest issue is one of confidentiality. Because it's a small community, I get asked questions such as, do you know or do you treat, and they say the name of their friend, niece, or nephew. So you have to be very, very careful about that because, again, patient confidentiality, no matter where you practice, is utmost importance and is part of our oath of commitment. As far as answering dental issue questions, I have no problem with that. To me, this is a part of my life. Dentistry and my chosen profession is a part of who I am. And I absolutely do not mind giving advice on the side.
Unfortunately, questions outside of the dental office are a problem no matter where one chooses to practice. But as someone who has navigated these issues countless of times, how do you strike a balance? And what advice would you give to a young dentist stepping into a similar settings, especially in a small community?
I would not give a diagnosis because you're not doing a clinical examination. They're not in the chair. You don't have the radiographs. And you certainly don't want to be speaking in contradiction to what their dentist may have already decided as a treatment plan, the recommended treatment plan for them. So you do have to tread carefully. And again, regarding the confidentiality, usually I'll say, well, you'll have to ask them who they go to see. You really have to be very mindful that patient confidentiality is your responsibility and you cannot breach that.
That's great advice, Luan, especially since we're exploring, the aspect of professionalism. I also wanted to ask, do you find that there are opportunities for young dentists or yourself to connect with a local community outside of work?
Well, sort of as a follow up to the previous question, we do live and play with those that we work with and those that we treat. So, in that respect, I felt that it was really important to become involved as a way to be an integral part of the community and to give back to those that put their trust in me for their care, or as often the case in an orthodontic practice, the care of their children. It really shows by becoming involved that you're invested in the community and that you're there to stay. I have volunteered my time on many committees and for many community causes, and have chaired and been involved in many fundraising events for community organizations. During the Christmas season, I bring a string group to play Christmas carols for residents both of long term chronic care facilities and seniors' residences. Currently, I am working with the Timmins and District Dental Society to bring regular dental screenings for residents of one such long term care facility in Timmins.
These opportunities really do sound like a lot of fun. As dentists, however, unfortunately, we rarely have opportunities to interact with our patients beyond the clinic and often not even beyond the chair. For a social person, this type of community interaction seems enticing and a real perk to setting up in a small community. But with fewer practices up north, are longer hours and weekend calls also the norm? And additionally, how are walk ins and emergencies typically handled in what I would assume would be fully booked schedules?
I'm not sure that walk ins and emergencies would be dealt with differently here in Timmins than they would be in Southern Ontario within an individual dental practice. Dental practices here generally operate during working hours Monday to Friday, with a few that are open until 8 p.m. on certain evenings. However, the Timmins and District Dental Society has established an on call system working with the Timmins and District Hospital Emergency Department so that those who have dental emergencies after hours and on weekends or holidays, they can have their emergencies looked after. Each general dentist signs up for a rotation and a schedule is set up. And I have to say that the emergency room physicians here are fantastic at triaging the cases coming in, and they will contact the dentist on call, who then arranges to see them at their office. What I would love to see personally is the Timmins and District emergency room have a dental suite. Stay tuned because I'm working on that.
There you go, that's coming up. So you have clearly built a busy and impactful practice, Luan, but how do you balance that with family life and personal passions?
Well, it is important to take time for yourself and your family. Family first. That's what we always say. However, with a busy practice, this is much easier said than done. So, for me, part of the balance I have achieved in my professional life has been through my involvement in organized dentistry, which began right after I moved to Timmins when I joined my local component dental society. This was followed by volunteering at the provincial level with the Ontario Dental Association, an involvement that would span 3 decades, culminating as its president in 2017 and 18. But living in a rural community or even an urban community, it is easy to not see outside the four walls of our dental practice. Volunteering in organized dentistry is such a great way to stay in touch with the profession and to be involved in shaping the profession, guiding it through the many changes that are occurring on a continuous basis. In becoming involved, I also gave a voice to the concerns and issues of my northern colleagues, some of which can be quite different from our colleagues in the south. But I have to say that the best part of becoming involved is the people that you meet and work with and the lasting relationships that you form. However, it is important to balance our professional life with our personal life and family time. As challenges are met and overcome, there are many perks to living in a rural city, and living in Northern Ontario is definitely a lifestyle choice. It has allowed me to enjoy all of the things that I love to do, which includes all the outdoors have to offer, such as downhill and cross-country skiing, trading in my two skis for one slalom water ski in the summer, mountain biking, golfing, and every other kind of sport you can think of. One passion that I do have and that provides me great joy to me is music. I have the privilege of playing in the Timmins Symphony Orchestra in the first violin section and also play in various other groups for many different audiences. Another passion of mine is cooking. Timmins is a little culinarily challenged. It is improving, but it is a little culinarily challenged. So I love to cook and regularly host dinner parties for friends and family gatherings, trying out new recipes on everyone. I think there is nothing quite like the laughter and lively discussion around a dinner table.
I love that. I also used to play violin many years ago, and I must say, if you don't practice, then it's not going to be the same. I'm amazed that you still find time to practice, and clearly you have done very well. You're like the first violin, which is amazing.
Absolutely. Music, skiing, cooking. What a beautiful mix of passions. It sounds like Northern Ontario has truly become a home for you. For healthcare professionals in general, however, contemplating setting up in remote areas, what kind of support exists for their physical and emotional well being?
There are support networks such as health and wellness services and mental health services. We have them throughout the area, as well as in Timmins. One service, though, that may not be well known, but should be, is the Members Assistant Program provided by CDSPI Insurance Company. Now, the name is a little misleading in that you do not have to be a member or have insurance with CDSPI to access this service. You do not have to be a dentist or a member of the ODA or other dental organization to access this 24/7 service. And it is open to the dentist, specialist, their staff, and the families of both the practitioner and staff. I have knowledge of this service as the first committee that I volunteered on for the ODA was known at the time as Dentists at Risk. It was a committee of 6 volunteers, and we would take calls from dentists or staff of dental offices across Ontario and make a referral to a particular service that would benefit the individual and assist in the resolution of their particular issue based on what they were telling us in the phone call. But with the advent of this CDSBI Members Assistance Program, the committee was disbanded as we now had a central service for those individuals in distress to access, which was staffed by experts in the field.
And speaking of support, tell us more about your team. What's unique about the culture in a northern dental practice, and how does it shape the way you work together?
Well, I can say that most of my staff have been with me since the early days of my practice, so I regard them as family, and I know how blessed I am by such a wonderful working relationship. I think treating people with respect, believing in them, and helping them develop their potential is so key in developing a lasting relationship. Showing appreciation for their hard work, their ideas, and generally for always going the extra mile are central in my office. Dentistry is, in many sectors, has a shortage of dental assistants and dental auxiliaries. In 2016, a survey was sent out by the Canadian Dental Association, which revealed that the number one reason for dental assistants to leave the profession was not financial, but rather was due to a lack of respect that they felt by the dentist and by other staff towards them. Being kind to another person costs absolutely nothing, and yet it can make that person feel valued and will go a long way in developing a long lasting working relationship. Is this unique to offices in Northern Ontario? I would hope and would like to think that this applies to all dental offices, no matter where in the province they are located.
That is so true. The loyalty of staff to the practice and the value they place on their place of employment goes well beyond the paycheck and includes these extrinsic factors that you've mentioned. But let's talk growth. What opportunities exist for continuing education, mentorship, or advanced training in Northern Ontario for both you, the dentist, and your staff?
Well, I think prior to the development of the meeting platforms, which were honed and refined out of necessity during the COVID-19 pandemic, people in Northern Ontario would have to travel to larger centers, to conferences where continuing education was offered, or attend individual lectures. As a member of the Timmins District Dental Society, my role a few years ago was to organize speakers to come to present to our members and to run workshops for hands on opportunities. However, again, with the development of these wonderful meeting platforms, online courses and podcasts and on demand courses are now available to everyone, no matter what your geographic location is, on a variety of subjects. For advanced training, Northern Ontario dentists will travel to courses, often combining these trips with family vacation time. With respect to mentorship, the best way to achieve this within the community is to join your local component dental society. This is especially critical at the start of your dental career, but as we never stop learning, it continues to be valuable even for someone like myself after 3 decades in practice.
Now, Luan, throughout the years, do you find it difficult to keep yourself and your practice current with the new technologies and trends?
Well, being involved in organized dentistry really helped. It meant traveling and often included attendance at dental conferences. This provided learning opportunities to not only stay at the forefront of our new technologies, but also it allowed me to evaluate the science behind these technologies and trends to ensure that they are sound before putting them to practice in my office. But this does involve traveling time away from the office, time away from the family, as well as the expense of closing the office and travel and accommodation costs. However, as previously discussed, the development of online platforms has greatly improved access to information on new and exciting technologies and clinical procedures.
Luann, in terms of dentistry in general, however, and your specialty, can you share specific strategies that you found that helped you stay at the forefront of your field?
I think it's because I am a curious person by nature and I absolutely love learning. Although, as we have discussed, education opportunities are opening up to those in the North through the use of electronic platforms, living in Northern Ontario can still feel pretty isolated. I make it a point to attend continuing education courses in my specialty and as well to attend conferences. They are a great way to reconnect with colleagues from around the province, providing networking opportunities, as well as learning from experts in the different disciplines, which ultimately translates to my ability to provide my patients with the latest evidence based techniques and leads to improved treatment outcomes for all.
Luang, I love our conversation and thank you so much for sharing your journey with such honesty and heart. You have shown us that leadership isn't just about doing, it's about being. It is about being present, staying curious, and standing by the people we care for. And truly, your journey is just a beautiful example of what it means to lead with purpose, and it has inspired us all.
And I would like to thank you, our audience, for joining our discussion today. Be sure to follow us on Instagram at ACD Ontario and on Facebook for updates on upcoming Pillars Pod issues released every month.
And that's a wrap from me, Saira, and my co host, Sonia. Thanks for joining us on the Pillars Pod, where dentistry meets excellence, ethics, professionalism, and leadership. And every conversation helps us grow stronger together. See you next time.